In the 1990s, pharmaceutical companies began to aggressively market opioids for pain management, reassuring physicians that these drugs would not become addictive to their patients. As a result, the number of opioids prescribed in the United States increased 300% between 1991 and 2009. For example, between 2007 and 2012, 780 million tablets of oxycodone and hydrocodone were dispensed in West Virginia, a state with less than 2 million people. The goal was to relieve pain and suffering, but the result was a surplus availability of opioids and an epidemic of addiction. Each year in the United States, approximately 50,000 people die because of an opioid overdose. And about 40% of those deaths can be traced back to legally obtained opioids prescribed by a licensed physician. While these statistics are startling and tragic, you're probably wondering what they have to do with veterinary medicine. Dr. Stephanie Keating is a board-certified anesthesiologist and pain management expert.
Injectably administered opioids are some of the most effective pain medications that we have in our hospitalized veterinary patients. But orally administered opioids, on the other hand, are much less effective, but they're still commonly prescribed by veterinarians, and they certainly carry tremendous abuse potential by people. We don't really have a good sense, in light of the current opioid epidemic, how much veterinary opioid prescriptions are contributing to this, but there was a study released by the University of Pennsylvania which has shown an increase in veterinary opioid prescriptions since 2007, and that increase has paralleled what we've seen on the human side.
Even if veterinary prescriptions of opioids have increased, how do humans access these prescriptions? Dr. Maureen McMichael is an expert in emergency medicine and critical care.
When humans abuse or sell drugs prescribed to animals, this is known as drug diversion. Data is limited and mostly anecdotal, but there have been reports of people deliberately injuring their pets in order to access opioid prescriptions. One way this has been done is for an owner to take an animal from veterinarian to veterinarian, having the animal prescribe the same drugs over and over in order for the owner to get the drugs for their own use.
While data is lacking, there are obvious risks, and veterinarians need to take reasonable measures to prevent drug diversion and abuse. In this course, we're going to talk about the importance of pain management and the unique aspects of opioid pharmacology in dogs and cats. We'll also talk about the appropriate use of outpatient opioid prescriptions and the recommended disposal of these drugs. And we'll review alternative pain management strategies. Thank you for joining us for this important course.